Mastitis is a well-known challenge in dairy farming, but many dairy farmers overlook a critical period when infections silently take hold, the dry period. Even though cows are not producing milk during this time, mastitis can still develop unnoticed, only to flare up after calving. This invisible threat can significantly impact milk production, udder health, and overall herd profitability. Understanding why mastitis occurs during the dry period and how to prevent it is essential for maintaining a healthy and productive dairy herd. The dry period is divided into three main phases, each with different levels of susceptibility to mastitis. During the first 3 to 4 weeks after dry-off, known as active involution, when milking stops, milk accumulates in the udder, increasing intramammary pressure. The teat canal remains open for several days, making it an easy entry point for bacteria. If proper dry-off procedures are not followed, the risk of infection increases significantly. In the mid-dry period, or steady-state involution, which lasts from weeks 4 to 6, the body naturally produces protective elements like lactoferrin, which inhibit bacterial growth. However, not all cows develop a keratin plug in the teat canal, leaving some teats exposed to bacterial invasion. Environmental bacteria from dirty bedding, manure, and poor barn conditions can lead to subclinical infections. In the last 2 to 3 weeks before calving, during colostrogenesis, the cow's body starts preparing for lactation again, and the udder begins to produce colostrum. The keratin plug may dissolve prematurely, reopening the teat canal and increasing infection risk. Bacteria that entered earlier may multiply, leading to clinical mastitis immediately after calving. Even if symptoms are not visible during the dry period, infections can cause higher rates of clinical mastitis post-calving, reduced milk production, increased somatic cell counts, and higher antibiotic use and treatment costs. To prevent mastitis during the dry period, dairy farmers should use selective or blanket dry cow therapy, apply internal teat sealants, ensure clean and dry housing, manage nutrition for immune support, and monitor dry cows closely. While the dry period may seem like a resting phase for dairy cows, it is actually a high-risk window for mastitis infections. These silent infections can reappear after calving, leading to costly treatments, milk loss, and long-term udder damage. By implementing strategic dry cow management practices, dairy farmers can protect udder health and improve milk production.